we're seeing the newest surge now that is spreading like wildfire. We are seeing pediatric hospitalizations increase across the country. We don't know if this is necessarily more serious for kids, but what we do know, because more kids are being infected, there are more kids that end up being hospitalized. This is a serious illness. While many children might have mild symptoms, there are those that aren't having mild symptoms and that are being hospitalized. For a couple of reasons. One is the Omicron variant. It has definitely been a little more evasive, and it's much more easily spread, more contagious than the Delta variant was. And so the other piece is that we know the vaccine's effectiveness does wane over time, and we now have some good data coming out of Israel as well as the US that shows that the initial 2-dose series, the effectiveness wanes after 5 to 6 months. And so between both the Omicron variant, which is now here and spreading like wildfire, and the fact that the vaccines lose effectiveness over time, it's really important that anyone 12 and up get their booster dose of vaccine. Booster doses are very common. If you think about most of the vaccines we start giving children at 2 months of age, they're 3, 4, 5-dose series over the course of months to years. So this isn't necessarily surprising at all. As we know, the flu shot is an annual vaccine. We don't know yet if this is going to have to be that or not, but we do know that as of right now, getting that extra booster dose 5 to 6 months after your initial series of the Pfizer vaccine really helps provide additional protection against the Omicron variant. It's the idea of providing better protection for your child as well as better protection for those children around you. In terms of side effects, it's the usual kind of soreness of the arm, a little bit of fatigue or achiness for a day or two, occasionally a fever. There is reassuring data that the booster doses are actually less likely to cause myocarditis than the second dose of the initial series. And again, for any of those cases that have been out there, they've been mild, they've been self-limited, kids have recovered quickly. And we know that your chances of getting myocarditis or inflammation of the heart from getting COVID is much higher than your chances of getting it from the vaccine.